Okay, well, welcome everybody to today's series of the University of Idaho Beef webinar. We're really grateful for all of those that are jumping on the live stream right now and appreciate any of those that go back and watch the recording later. We'll be offering this again in 2 weeks with promotion coming out for that at a later date on subject and guest speakers. Today, we're going to talk about spring work, going over vaccination protocols for your herd, whether it's a mature cow or the calves. In addition, we'll also talk about some of the processing practices to be keeping in mind and trying to perform as we approach the turnout season for grazing. I'm going to go ahead and turn things over to Dr. Jim England, who joins us, and he's going to cover the vaccination protocols for us today. So, Dr. England.
Thank you, Miranda. Thank you, Melinda, for including me in this. A little word of caution, our bandwidth up here sometimes on the side of the hill I live on in Emmett kicks out periodically. So if I happen to go silent, it's not that I got up and left it. I'll have to come back on. Thank you for attending, and I want to talk today about cow-calf health considerations, basically vaccination and worming programs for cow-calf operations. To begin with, I'm a proponent of core vaccines, something I get on a regular basis. And if you happen to a local farm store and see something like the cabinet full of vaccines on the left, your first question is what the devil should I use? Well, my first response is, one, talk with your veterinarian that understands your operation. For me, though, the core vaccinations out of that whole cabinet that every animal should get every year are the 5-way virals, IBR, BVD, 2 types of BVD, BRSV, and PI3, and then the clostridials, the 8-way clostridials, which are the blackleg and those sorts of things. Remembering that 8-way vaccines, for the most part, do not contain tetanus, and Miranda will talk about a little bit later. We do not use tetanus nearly as much in cattle as we do in the small ruminants. So the core vaccines to all cattle every year are the virals and the 8-way clostridials. All the other vaccines that you see in that cabinet are, from my perspective, optional vaccines. You should select them based on the site and if you have a specific problem in your herd. Site might be if you're running irrigated pasture versus high mountain, or if you're having various respiratory problems, summer pneumonia, etc., you might want to adjust your vaccination protocol working with your veterinarian. Amongst the optional vaccines, there's considerable controversy depending on who you talk to. One of the problems with many of them is its inconsistent usage. The core vaccines that we've mentioned, the virals and the clostridials, are very consistently used across the spectrum of cattle producers. The other side, some of them of the optional vaccines have a risk-benefit concern, like side effects. Some of the Pastorella vaccines tend to knock animals off feed for a while, so you kind of have to consider that. If you look at some of them, the mycoplasmas is a good example that their antigens or the makeup of the vaccine that the host or the animal supposed to respond to are poor antigens and very diverse, and some of them are quite expensive. The vaccines that I look at as optional vaccines would be the diarrheal agents like rotas and coronas and the coliforms, the respiratory agents such as the pastorellas and mycoplasmas, and also you might want to include in there the pink eye things. And then we have some that are good for venereal or disease problems like trichomonas, the lepto, and the vibrio. Trichomonas is really the only parasite vaccine that we have on the market for cattle. If we look at the effect of these various vaccines over time that we've had available for use in the cow-calf operation, the positive ones, the IBR, BVD, brucellosa, clostridials, and leptos, have had very positive effects on production. The pastorellas, some of the more recent additions to the pool, are looking much better, and they're causing fewer side effects. The scours vaccines have had a positive effect in many places, the main thing being that they need to be utilized on a yearly basis. Some of the more controversial ones would be the salmonellas, foot rot, pink eye, wart vaccines, and mycoplasma. And a major controversy is people use them and not convinced they see what they should see for a positive effect. Then we've got a couple that kind of depend on whether they're going to be determined and whether they're even available at various times. The anaplasma is kind of off and on the board as to when it might be available. And again, it's pretty controversial as to how well it works. Let's talk about the core vaccinations for baby calves. One of the current heavy discussion areas is neonatal vaccination. That's vaccinating calves at birth. And we're seeing more of that. And it usually runs around giving an intranasal IBR, PI3B, RSV, and a clostridial at birth, occasionally a scours vaccine. Most of one thing you have to be aware of is if you're using a modified live injectable, maternal antibody can cause considerable interference in the functionality of the vaccine. The intranasals that you use on newborn calves are nowhere nearly as adversely affected by maternal antibody as are the injectable modified lives. For vaccinating calves at our standard branding time, again, I recommend the core, and depending on what you might have, excuse me, pardon me, for respiratory problems, such as summer pneumonia on your, I would recommend using an intranasal in addition to the injectable 5-way. One thing you need to remember with the injectable 5-ways again is that at that age, you may have somewhere around 50% of the animals that wouldn't be immunized by that shot. So consequently, I really urge that you revaccinate everything when you come down off the mountain or at weaning. Weaning steers, the weaning steers, and the core of the clostridial and the 8-way, we're seeing more and more of the preconditioning programs being requested with weanling animals, and they can be anywhere from 26 to 38 to 45 days. And oftentimes they want you to wean them, vaccinate them prior to weaning for a better response. Optional vaccines, most common ones are like lepto, Haemophilus, and excuse me, Pasteurella, and generally they're at the request of the feedlot or the person that's buying your weaning calves. Weaning heifers in Idaho, the main thing we have to make sure we do at weaning is vaccinate for brucellosis, required by law from 4 to 12 months of age and done by a veterinarian. If they're going on the replacement route, make sure they get another 5-way and a clostridial and brucellosis. When you're talking, getting out there to yearlings or so and you're looking to replacement heifers, I recommend that you do another modified live 5-way. My recommendation for replacement heifers is 3 modified lives prior to turning the bulls in, at branding, weaning, and then about 30 days to pre-breeding. This gives you a very good immunity, and it also helps them produce a better quality colostrum. They also the clostridial 8-way, the 2+ per year. If you happen to be running on a pasture and have run the risk of red water, they really ought to be vaccinated twice a year with the 8-way to give you the protection that you need against the red water or the clostridial hemolysis. The others are optional for calves. Heifers, you might, if you've had problems with abortion, you might consider Vibrio or Lepto. Those vaccines tend to have a shorter term immunity. For the mature cows, still the same core vaccination, Vibrio, Lepto. Many people use. I think those are especially important if you're running on irrigated pastures. If you're running on frozen up winter pastures and in mountains in the summer, the risk is much, much less for those 2 abortifacients. The goal is basically to maximize colostral quality and also to give you fetal protection against persistent BVD infections and abortion protection against IBR and BVD. Bulls, sometimes they fall through the cracks. They should get a core. I do recommend that you vaccinate bulls twice a year. I more commonly see blackleg malignant edema in bulls, which I think is relative to their fighting. So I really recommend twice-year vaccination for the Clostridial on bulls, yearly 1 month breeding for the modified live 5-way. And one of the reasons to recommend a month before is there's been some concern and some older reports of IBR maybe being shed in the semen if you vaccinate them too close to breeding season. And you may want to give Vibrio lepto, although it's of minimal value in bulls. Talk about the dewormers, the use of dewormers for cow-calf operations, and it's kind of a case of dewormers versus the producer. The problem we have with dewormers is that we're starting to see increased resistance in cattle parasites. In the Southeast, it's much more prevalent to see increased resistance developing in cattle. The small ruminants are having lots of problems with resistance, parasite resistance to the wormers we have. So we need to bear that in mind and make sure we don't cause the same level of problem that we see in small ruminants. The other thing is we have a limited number of drugs that are available to use to treat parasites. We tend to have misused or overused what we have had, hence the problem. And the big thing is at this juncture, there are no new parasiticides on the horizon. So we have to really beware on how we're utilizing these things to maintain their usefulness. What can we use and how do we use them? Right now, we basically have 3 groups of dewormers available: the albendazole, fenbendazole group, the ivermectins like ivermectin and moxidectin, and then we have the older forms of levamisole, which went out of use for about 20 years and it's making a comeback. People quit using it. It's actually starting to work again. And then Morantel and Pyrantel products. The common practices we've had that have led to some of the problems is we rotate dewormers too often. Excuse me, pardon me. One of the big problems is we treat them and then we put them in a new pasture, so we're seeding out only with resistant parasites. One of a standard problem is we're underdosing the animals because we haven't picked a good true weight. Scales on chutes are helping us immensely on that, because that way we dose them appropriately. We don't underdose, and we don't tend to waste parasiticide by overdosing. One of the things we do too sometimes is we treat too often, and often with that we're not treating with enough product. The other thing we do in the cattle industry is we treat without confirming that we actually have an infestation. There are reports out there, and good reports that have shown some that are years ago, that treating cattle before they go into a feedlot really helped improvements in the feedlot. Consequently, I think that's how we got to thinking that we needed to worm once or twice a year for everything. And so it's led a little bit, had a lot to do with what we, in terms of overusing and misusing the materials that we have available for parasite control in cattle. We're back to the problem of the resistance. Remember, we have the 3 classes or groups of dewormers. The problems is that if you have resistance to one in that group or class, then there's varying degrees of resistance to all the members of that group. The other thing is we might have multi-drug resistance, which has to do with overuse and too frequent a rotation of our parasiticides. So we might find out that we have 1, 2, or 3 of the classes of dewormers that's not functioning. Excuse me. Superworms consequently have developed that are pretty tough to treat. Again, this is a much bigger problem in small ruminants than we're seeing in cattle, specifically in the Northwest and West compared to the Southeast. Again, things that are contributing to the deworming problems in practice: we treat the animals and move them immediately to a new pasture, so we're seeding excuse me, resistant worms into the pasture. One of the things that's a problem, certainly with Ostratasia, is we treat early in the spring. The organism or the worm is in a hypobiotic state, not functional, so the wormer won't treat it. So we have to wait until after the last frost, at least shortly thereafter, to get everything that's back and functioning within the host. And then if we undertreat or overtreat, we do it too often. We're not weighing animals and getting the right treatment. And of course, one of the problems we see is with goats, they have a higher metabolism. And there's some discussion that we might see some of that as a little bit of breed differences in beef, but I've only heard that as discussions. I haven't seen anything peer reviewed and published regarding that being the actual case in cattle. But the big problem is inappropriate treatment. We're not treating them for the exact weight. So better practices to use for deworming purposes. If you don't have a scales, then treat for the heaviest in the class, not the average. In the long haul, it's better to overtreat than to undertreat. Make sure your equipment is proper, that it works well. If you're doing the intubation or oral, make sure you get the tube feeder back over the bulb of the tongue and they're getting a good dose, and make sure your equipment is calibrated, that it delivers what it says it delivers. One of the things that helps, especially if you're doing the oral treatments, is to withhold feed for 24 hours after worming. It helps maintain the contact time within the intestine. So that's one recommendation, is to withhold feed. Going back on pasture, the way we do a lot of our cow-calf operations, it's not terribly feasible, but it's something to consider. One of the things that is suggested, and I suggest it very heavily, is don't worm 100% of your animals. Worm about 75% on a random basis. Leave them on the pasture that you pulled them out of before you treated them, so you're not contaminating a new pasture with resistant organisms. A couple of other things to remember: don't buy resistance. If you're buying animals, find out what their worming program has been. Quarantine the animals, and I would test fecals on them. Pull some samples from your animals, send them to your veterinarian, and have them identify what their worm load is like. Routinely do fecals on your animals. I recommend at least once a year, selecting from your various age groups. A half a dozen to 10 samples will give you a pretty good idea of what's happening in your herd. Your veterinarian and have them do a quantitative fecal for you. You're looking at something on the of $100 to $150 to do that. But if you don't need to treat, you're saving a lot of money on top of that. One of the other problems we see, at least with some of the smaller operations that don't have lots of pasture facilities, they can't rotate and let a pasture rest. So we're having contaminated pastures, and the bulk of our oral intestinal parasites rely on water and irrigation to survive and to replicate before they reinfect an animal. So irrigated pastures, parasites are much more of a concern. Overstocking in these small pastures where you got lots of shedding, they're grazing it clear down to the ground, so they're eating everything that contribute to reinfestation. The other thing you need to think about is what we call strategic deworming, looking at when is the best time to worm. For the most part here in the Northwest, right after or right around the very last hard freeze, you'll get all the adults, and they're not being dumped out into the pastures. And then right after the first real hard freeze in the fall, if you're going to do twice a year, worm again to clean them out over the winter, so they don't have a lot of worms going hypobiotic or causing winter problems. One of the concerns or suggestions at this date is to work with what's called refugia, and that's trying to maintain a certain number of viable parasites that are susceptible within your herd. And if you go to this FDA website, they have a very nice handout on what they call refugia. We know cattle develop an immunity to worms to varying degrees, and so it's not truly necessary to wipe them clean every time. So if you use refugia, you're selecting animals that need to be treated. At the very least, only worm about 75% of your animals per worming, so that you're not clearing everything out and dumping only the resistant organisms into your pasture. For both vaccines and parasite treatments, I repeatedly recommend that you work with your veterinarian, that you have a veterinarian that understands your operation and your problems and your facilities, etc. Are there any questions?
Yes, in the chat box, there was a question about what are the recommendations for treating liver flukes?
Liver flukes, we only have two products that we can actually use to treat liver flukes with. One is valbazin. It will treat flukes. And the other one is Ivomec Plus, the Chlorshilon. You can actually get Chlorshilon separately when it's available. There have been some problems with it being available here in the last year or so. That's where it's really key to do a treatment right around the very last hard freeze, because you wipe out all the adults and they're not reseeding your pasture by passing eggs when you turn them out. And then you do them in the fall after the freeze. Then you kill the adults that are in the animal, and so you don't have further liver damage. And we generally apply that approach to the other parasites too, at least in the Northwest, because we know in a normal season when we have freezing conditions that kills a lot of the eggs and reduces our parasite load come spring. But it's a spring and fall treatment thing, and we only have two products, valbazin and the Chlorshilon products.
And I'm going to take over and talk about the processing side of things when we're thinking about spring work. And really, it's more just kind of a checklist to help you refresh your memory as we move into our new spring work season. So Dr. England was really great in covering what exactly we should be providing to our cattle as we get ready to put them through the chute or brand or get them turned out. And so another component when we're thinking about what they need to be given is how we're handling our vaccines. It's really important to be purchasing your vaccines from reputable sources, whether that's you have a great relationship with a pharmaceutical rep or you work really closely with your farm supply store. It's just important to make sure that you're getting a quality vaccine to utilize in your operation. When mixing up modified lives, it's ideal if you can use them within the hour, 2 as a max, because after this point, the live pathogens start to die off within that vaccine. Use transfer needles when you can. If you can't use a transfer needle or don't have one, starting with a clean needle to mix up the dilute with the compound would then be preferred. Don't use a dirty needle that you've been injecting previous animals with. Don't shake up the vaccine too vigorously, as it may denature some of the compounds within that. Be mindful to never mix your products when we're applying several at a time, as this can cause a reduction in the vaccine's efficacy. Keep track of your vaccine guns. It's really kind of a good practice to just go ahead and label them for what you intend to use them for on a regular basis. The issue that you can run into if you're mixing up your vaccine guns is a gun that was being previously used for modified live and then refilled with a killed product can have an effect on the efficacy of that product. And then it's really going to be vital in having a great efficacy and response out of our vaccines if cattle are being managed in a way to enhance their immune response. And that simply means, even though we have to have stressful events with our cattle, making them as least stressful as possible or as infrequently as possible, ensuring that our animals are getting a good nutrition program to give the body a fighting chance to utilize those vaccines properly. Another component when we're talking about handling our vaccines is the storage time. They're very temperature sensitive products, and so an appropriate range to keep them at would be between 35 and 45 degrees Fahrenheit. You also want to make sure that they don't freeze at any point in time, as that's going to have a consequence with especially our killed vaccines that can result in the adjuvant's structure being altered, which then changes the vaccine's efficacy through altering the immune response to the antigen. And you want to be mindful to try and keep them out of UV light. Back in 2010, several of our extension educators teamed up with some of the beef specialists to get a better idea of how many refrigerators are actually maintaining that ideal temperature. They put log readers in farm and supply stores, in producers' refrigerators on their personal operations, and kind of got an idea of where refrigerators are sitting at temperature rise on a regular basis. And what they found was that a third of the producers' refrigerators were at the correct temperature more than 95% of the time, which is great. Unfortunately, on the other end of that spectrum, a third of the refrigerators were at the correct temperature only about 5% of the time, which means your refrigerator may not be keeping your vaccine at that correct temperature like you could assume it is. Consider putting a reader in your storage refrigerator. Also keep in mind those refrigerators that are housed in outbuildings are going to be affected by the temperature extremes. So when you go to put what's left over of vaccines back in there in the fall and leave them in there over the winter where temperatures are dropping, they may have potentially frozen at a point in time, and you would be none the wiser because by the spring when we go to use them again, they've already thawed back out. When we're talking about administering our pharmaceuticals, we really need to be thinking about selecting the right needle for the job, which is going to be based a lot on cattle size. In addition to that, be mindful of the route of administration of the product that you're going to be administering, as well as the viscosity of it. BQA recommends changing out needles every 10 to 15 head. But you have to also kind of be putting some logical reminders in your head, because nobody, I imagine, is standing there with a clicker and saying, ah, we've got to 15, time to change needles. So if you're working with a system, it makes sense to do it every draft to fill up the tub, alleyway, and chute. And then every time you have to refill a syringe gun. Anytime there's any damage to the needle, it's really discouraged to ever try and fix a bent needle. And then between cattle that you know potentially have some illness taking place that could be bloodborne or infectious. The reason for the 10 to 15 head is that after this, you should start to feel resistance during injections, as that needle is going to start dulling and developing burrs. When it comes to needle disposal, at the end of the day, you'll have quite the pile of them. It's recommended to follow your local, state, and federal EPA guidelines. Ideally, you have a sealable sharps container and can dispose of in an approved landfill. However, from what I have come to find in Idaho's regulations, there aren't really any. And when you talk to some of the veterinarians, their practice is kind of the same. They just fill up perhaps a bleach jug and seal it up, and it goes to the dump. When we're thinking about where we're going to give these injections on our animals, we need to be kind of thinking about where are we going to risk losing the least amount of product if there's an improper injection given. So we want to keep everything above the shoulders in that neck area, because there's not really a lot of product there that we're going to risk losing, which is why we can afford to give injections here, even if they might not go well. And this is going to be the site that should be utilized, whether it's a mature cow or a young calf. And the reason I say this even with calves is because extended time between injections and slaughter doesn't necessarily mean issues aren't still there. They've found that vaccine and vitamin injections applied in the round and the top of the butt at branding that resulted in an abscess or a lesion can still be evident by the time the animal reaches harvest. So it's really important in trying to achieve getting injections in this precise location to have the animals properly restrained. It's also just something really good to keep in mind and teach your entire crew is to keep all those injections in front of the shoulder. When possible, be utilizing subcutaneous products. Unfortunately, a lot of the pharmaceutical products out there are subcutaneous. Try to avoid administering more than 10 cc's per injection site, which is less for calves. And then keep your injections at least 4 inches apart or the width of your hand. And always be kind of paying attention and following the product labels. It's, again, really ideal to have experienced personnel administering these pharmaceuticals, but experience also comes with proper training and practice. Another option is to utilize intranasals, which Dr. England spoke to earlier in our presentation, as far as that kind of an application option. So when we then move on to our syringe options, the first one to kind of keep in mind would perhaps be continuous feed. This is a really popular option in the feedlot settings as they reduce any chance of contaminating the bottle. However, these ones are harder to keep clean, and it's also hard to shelter the syringe line from exposure. And then additionally, because these bottles are hanging chute side, they too get a lot of exposure to sunlight and weather influences, which can cause a deterioration in the vaccine and then lessen the immunization effect. So if you're going to be doing that, it's really recommended to get a sleeve for at least the vaccine bottle. The other option, and probably the more popular option for a cow-calf, would be the multi-dose or pistol guns. These are a little easier to keep out of the elements, especially if you can buy or build yourself a vaccine gun cooler. One of these kind of coolers that's up on the slide, they're pretty pricey. They're very handy, but you could create your own by getting a styrofoam cooler from a grocery store and just cutting holes into it. These two require cleaning after each use with distilled water and soap, followed with boiling in distilled water to rinse them. And then they need to be stored out of the dust and allowed to fully dry. Before you go to start working cattle for the day, you need to keep in mind it's important to inspect your syringes prior to the processing, checking for any chips or cracks that could lead to leakage, which then causes an underdosage issue. And then as you're going through the processing day, just continuously monitor and check that dosage setting. So for those operations that utilize implants, be careful not to implant an ear that is covered with any kind of contaminant, whether it's manure or caked on mud or even urine. The reason for this is that kind of a contamination can increase the likelihood of an infection or an abscess, and then that's going to interfere with that implant working properly. You also want to try and avoid placing the implants in the same ear that you're utilizing for dangle tags, tattooing, or ear notching. And then when you go to apply and administer the pellets, you want to make sure that they don't bunch up in the ear or pinch or break within the ear, as that too is going to be something that reduces their efficacy. When it's time to do the actual administration, you need to think of implants a lot like vaccines, and they need to be handled properly to ensure that they work correctly and also to try and reduce a rate of infection. So this is aided to by having the animals properly restrained. When it's time to do the placement, it goes between the skin and the cartilage in the middle third of the ear. And then as you're going through implanting calves, you want to try and make sure you're disinfecting that needle before the new animal comes in. And the reason being, it's a large needle and it can pick up a lot more contamination that you don't want to pass from one animal to the next. Appropriate disinfectants would include water that you've mixed with rubbing alcohol or hydrogen peroxide, an iodine solution, and a soaked sponge. However, a lot of these kits come with disinfecting solutions and equipment. Now, if you're choosing to implant your suckling calves, obviously right now during spring working season, it's a good opportunity to do so, as calves can be implanted as young as 45 days. The next opportunity window would probably be weaning. provided you're going to be able to give those calves a really high quality diet during the preconditioning phase to get the full benefit out of that implant. Each operation has their own management practices in relation to implanting, with some choosing not to implant heifers that are going to be intended for replacements. On top of this, you want to be really mindful of record keeping with your implants, when you've implanted, what the product was, as the next production phase, whether that's a backgrounding yard or a feed yard, they're going to want to be aware of that so that they know the timing if they are a yard that utilizes implants as well. So as we're getting ready, we want to kind of make sure our facilities are ready to go too. So you want to ensure that your working corral is set with your fences and panels secured so that there's no breakaways during sorting of the mother cows from calves, or when you're actually working the calves, whether you're an operation that implements head and heel roping or heel roping, if you like to use a roe deer setup, or if you are an operation that utilizes a calf table. If using a calf table, check that it's working smoothly so that midway through there's not a loose pin that falls out, which would bring the whole day kind of to an end, or at least to a standstill while the table gets worked on. And the same goes for your chute for your mature cows when they're going through as well. And also, if you're going to be roping, make sure you're walking your drag area, removing any debris that could cause an injury to the calf or to your ground crew, or just be in the way or injure a horse. And again, make sure you've informed your ground crew of what shots need to be given that day to what animals, how many shots are going to a mature cow versus a calf. If any of your bull calves that are becoming steer calves need an additional shot, such as the tetanus. And then also make sure your ground crew knows, again, that these shots need to all be given in the shoulder, up above the shoulder and the neck, and subcutaneously and spaced out as best as possible. Calves don't have a lot of surface area to work with, but it needs to be attempted at least. I'm not going to go a lot into actual handling. That's a subject in and of itself, but I will talk about the tools that we would perhaps be using on a working day. And these really should just be considered an extension of the handler's body and used calm and sparingly if possible. The BQA guidelines are that under desirable conditions, 90% of your cattle should flow through a handling system if that's what you're using for your spring work, without the use of electric prods. And so if you must use electric prods, however, you want to avoid contact with any of the sensitive areas on the animal, including their eyes, the rectum, genitalia, and udder. If cattle are continuously balking, you might want to investigate what the hang-up is rather than resorting to overusing the electric prod. The other option would be to implement non-electric driving aids, such as paddles, sorting sticks, and flags. Now, under most conditions, no more than 2% of your animals should fall when they're exiting the chute, and no more than 25% should jump or run when exiting the chute. However, cattle that have been suddenly exposed to processing conditions or equipment are going to probably be more inclined to run or jump out of the chute, as well as vocalize. If more than 5% of your cattle are vocalizing after they've been squeezed but prior to any procedures, this could potentially be an indication that your chute operation just needs to be evaluated. So when we start then working our calves, one of the main things that's got to be taken care of for our bull calves is castration. Ideally, this is a process that's done before the calf reaches 121 days of age. Methods that are pretty common would include surgical or cutting, banding, or crushing and disruption of the spermatic cord. Each producer has their own preference on castration methods. Some choose to band when they first tag the calf, while others cut the testicles out during branding. If banding shortly after birth, this is the time now during spring work to check each bull calf to see how progress is going and make sure that there's no infection. The next opportunity to do banding, if you didn't do it when the calf first hit the ground, would be right now, which may be the better time, as you don't want to add to the calf's stress when they're first born and do any additional weakening of that immune system. When you're banding, be observant to ensure that you've pulled both testicles through And then also for those that are cutting, this is a job that's going to be best given to someone who's experienced with this, that doesn't cut too deeply and knows how to follow through with applying a disinfectant and a fly repellent. Prior to, have your castration knives clean and be sharpening them throughout the day, and also have all your disinfecting tools that you need sanitized and ready to go. And again, it's a good idea to make sure your bull calves are also receiving a tetanus, just to kind of help stave off any infection that comes with this process step. So dehorning is a process that can be just as, or perhaps even more stressful than castration. And research has shown that dehorning or tipping older calves and yearlings is probably one of the most stressful management practices. So calves should be dehorned while the horn development is still at the horn bud stage, or at the first available handling opportunity, which would be between 0 and 4 months, or before the horn base has reached 1 inch in diameter. And this is because at this stage development, the procedure is a lot less tissue traumatic. So methods of this budding at the horn stage would include removal of the horn buds with a knife or dehorning spoon, which is a Barnes dehorner, thermal cautery of the horn buds, or an application of a chemical paste to cauterize the horn buds. Be cautious of utilizing a paste to ensure that it's not going to get rubbed off onto the calf's mother or onto their herd mates, or that it's going to rain within 24 hours. And again, much like the castration tools, have all your dehorning equipment clean, sharpened, and ready to go with a disinfecting bucket to help keep them sanitized in between calves. So prior to the day of branding, it's a really good idea to make sure you have either full propane tanks or plenty of firewood to maintain your heat source if you're fire branding. If you're freeze branding, ensure that your nitrogen tanks are full, or that you've acquired plenty of dry ice and alcohol. Dry ice isn't always easy to come by, but a lot of welding stores have liquid nitrogen. When fire branding with a hide iron, don't brand with a brand that is too hot, or leave the brand on the hide for too long, as this may result in scar tissue and a tightening of the underlying muscle. Freeze branding is considered relatively painless, as it reduces hide damage, less blotching. However, it requires more time, it tends to be more expensive, and the visual results vary, as it doesn't seem to work as well on light colored hair coat cattle. As far as location goes, it's really becoming more of a preference to have hip brands versus anywhere else on the body. Part of that is just so we can maintain hide value, and part of that's also just there's maybe a little bit more tissue there to kind of take on the branding process. If you do any other forms of identification, such as ear notching, now is going to also be the time to take care of that as well. So besides dangle tags and brands, we have the practice of ear notching. But if this is a practice that you use in your operation, you want to try and leave at least a 1/4 inch between the notches and avoid notching too close to the tip of the ear. And you also want to try and make sure your notches aren't too shallow, as they may become closed up and difficult to read. The other option is implementing electronic identification tags in unison with a dangle tag, placing the tag within the first 1/4 from the head of the animal's ear between the ridges and the cartilage. You also want to try and make sure you're using a compatible front and back tag components so that they have a less chance of getting pulled out. These can be more expensive, obviously. However, there are some programs out there that work with producers to encourage them to utilize them for their program. This is also a great time to kind of start looking at some of your older gals and figuring out if it's time for them to go down the road this season, as you're getting a good eye on them right now. Some reasons to consider culling cattle would be she lost her calf this winter and she'll be out of cycle with everything else. Perhaps she's got a poor body condition and she's just not seeming to recover well, or she has developed some structural issues, including in her udder, that are starting to afflict her mobility. As far as her udder goes, it could be that it's starting to drag on the ground because it's lost suspension, or her teats have gotten so large that her calf seems to struggle with suckling. You also could, consider getting rid of cattle that are producing calves that tend to lag behind the rest of your herd if your goal is uniformity. However, this is probably more of a personal recommendation to each operation, as each operation kind of has their own production goals. This just could be part of that. And then also any animals that are aggressive and potentially dangerous. Now, if you're choosing to cull out cows sooner, you want to just make sure that they've cleared any of the treatments you've recently applied to, so that you're adhering to the withdrawal timelines. So finally, at the end of the day, we've got to make sure we've done our record keeping, as it's just good business practice. Fortunately, there's a lot of software programs out on the market today, as well as, good old pen and paper. So what type of system really doesn't matter, as long as it's something you use and are committed to utilizing for your operation to keep your records accurate. When it comes to tracking herd health, it would be recommended to track the treatments that you're utilizing in your operation, plus their efficacy. Track your applications, make your protocol adjustments as you need if you're noticing something's not working as well as it should be. And then just to help you keep in mind withdrawal times. Buyers like having access to this kind of information in detail, so that you can then provide that to the next phase, which could be the feed yard or a backgrounder. So then they know what kind of treatment protocols to then be using with your cattle as they come in. So it has an influence on your marketing. A copy of the records that you have kept should be made available to the cattle buyer, or whatever that next unit of operation is. And then ideally you're keeping a hold of your records for at least 2 years, even after you've sold cattle or transferred ownership or they've been slaughtered, as those are records that are important in tracking any kind of treatment history, as well as for you as an operation, just to kind of be keeping a pulse in how things are going, where you can make improvements, where things have been getting off that you didn't realize were getting off. It's also a good idea to make the record the day of the treatment rather than later on, as all of our memories get a little foggy every day. So when all is said and done for the day, give your mother cows time to pair back up with their calves before you kick them out. And then in the days following branding, take some time to go out and check those calves, as well as the cows, just kind of keeping an eye out for anything showing a sign of sickness or infection. Their feelings will probably be hurt, but we want to make sure everybody's healthy. Okay. Well, that's kind of all I had today. A lot of these topics are covered really in-depthly at the website here. If you have any more interest in kind of reading up on some more of them, I highly recommend it. And thank you guys all for your time.
Thank you.
Did we answer the question about what age the calves should be bangs vaccinated?
I did not see that question. I'm sorry.
That's okay.
I saw the question. I thought I had answered it. They need to be vaccinated between 4 and 12 months of age.